It's the 19th day of April, and it's Sunday once again, the day we get to do the Fourth Estate, a critique of the media and how it covered stories during the week. This week, we want to look very closely at how the media has covered the numbers that are coming out of the Ministry of Health with regard to COVID-19. Now, all through the years, data journalism has shaped how newsrooms report on recurring events when wars, poverty, and even socio-economic problems. Those numbers come partly from government sometimes and other times from NGOs. But in a state like COVID-19, all the numbers that the media is using have come from one source, the Ministry of Health. How many of us have been able to question them? And what kind of questions can be given to such an authoritative set of numbers? This week, we start by talking to Lydia Namobiru, a data journalist, to tell us what the media should do better in the coverage of numbers. The media and numbers, an undeniable marriage. For centuries, numbers have offered media a sense of context and scale, but they've also offered the media an undeniable task of verifying and interrogation. The COVID-19 pandemic has been mostly a story of numbers, the increase in confirmed cases and those under follow-up. It has also been a one-way traffic for government in communication. Tonight, we ask, how can the media interrogate the numbers from the Ministry of Health? Help us understand. For now, 2 weeks, the Ministry of Health has been releasing figures of cases of people in quarantine, or people in isolation, of tests that they've conducted. And in a sense, the media has decided to consume these numbers as a printing press, consume and release. No one is interrogating them. But also, in a sense, many journalists have asked, what is there to interrogate about numbers we don't have control over? As someone that's worked with numbers, as someone who deals with data, what do you make of that?
I think, first of all, everybody should be asking themselves, what's the use of communicating these numbers? Just because officials provide numbers doesn't mean you have to communicate them. Or so if you feel like there's nothing to interrogate, is there a chance that even the audience is wondering, so what am I supposed to do with these numbers? And if the audience is wondering what they're supposed to do with those numbers, maybe in the first place, it's better not. There's nothing to be lost in not passing those numbers on. But there are things to interrogate about those numbers, and I think if journalists are online and they're following other journalists and how they're covering the pandemic elsewhere, or even following smart analytical people online, people are asking those questions that journalists can ask themselves. Say, like with Uganda's numbers, we are wondering, do these represent the actual number of cases in the country? Chances are they're not, because only a very specific, only a narrow selection of the country is being tested. So the government has decided these are the most high-risk people, and we are going to test them. But there's nothing to say that just because I'm not high risk, I couldn't have possibly come in contact, with someone. I couldn't possibly have the virus. So the fact that there isn't community testing, and should there be community testing? So I think just generally journalists should go with the questions they have, instead of, like, when you have questions, this is what we do. When you have questions, you go to the source with them. And if the source can't answer those questions, then you say the source can answer those questions. It's not, you don't just repeat, you don't just go with what they have. Yeah. I think even the numbers the government doesn't have are news too. But also I think we are covering the pandemic as if we were epidemiologists doing research, right? Like just talking about the number of cases and the numbers that are directly related to infections or transmission or possible transmission. But a pandemic is a health issue, it's also a social issue. And even in terms of the health and the health system, as we are seeing from reporting elsewhere, it goes beyond cases, who has the illness and who doesn't. It also, for instance, right now, lockdown measures are making it difficult for people to go to hospital. And people don't go to hospital to hang out. If they cannot go to hospital now, what's happening to them? But in terms of numbers, we should be asking hospitals, how many patients did you see last month compared to how many patients are you seeing? And then we would be able to tell the public what the price, what the cost of these measures actually are, and they may be justifiable. But how does the public know they're justifiable if we are not telling them what gaps they are creating? How many mothers have failed to go to the between, say, last April or last March numbers of people who went to hospitals versus this number. But if you, in the case of maternal health, if you look at how much pregnant women being able to go to hospital contributed to any changes we've seen in maternal mortality over the past decade, then we would be able to tell people this is what we stand to lose. This difference in number of women, percentage of women attending hospital for antenatal and delivery led to this difference in maternal mortality rates, yeah? And now with the measures, with the lockdown measures, we are seeing this difference in this fall in number of women attending antenatal care and or delivering in hospitals. So we are likely then to see this many more deaths among mothers. Or if you're looking at how much access to contraception contributed to decrease in maternal mortality, and lockdowns are leading to lower access to maternal mortality. So can we tell people what it is, what the actual cost is? And the same would be true about other social impacts. When people are not able to go to work, what are they losing? And so actually, I think this pandemic presents an opportunity for media houses to be doing more data collection of their own. It's a very fast-moving situation. If you wait until at the end of the year when the authorities tell us how many Ugandans have fallen back into poverty, it's going to be too late. It'll just be a post-mortem. But can we do small data collection things? And I think it may be difficult for a station like NTV because most of your viewers are probably not missing meals as a result of lockdown. But this may be an opportunity for you to partner with local radio stations and have them set up some sort of alert system. How many people are reporting that we've switched from 2 meals a day to 1 meal a day? And you can report those numbers, honestly stating the limitations of your data collection, honestly stating, but you're filling a gap in the meantime that authorities will take a very long time to even count. So there's that. There's, first of all, ask yourself, why are we communicating this particular number in the first place? But also, what other things should we be counting and communicating? What other data analysis should we be doing and communicating beyond just cases?
That's another question that many editors have had to deal with. How do we work with already established data sets? Say, for example, census data, say, for example, UBOS data on workers' numbers. How do we work with already established data sets to tell a story at a time when half the country or nearly all the country is on a lockdown?
Yeah, that's interesting. I think so. Already established data sets are not going to be news, because the situation did not, for the most part, like that data doesn't refer to this situation. That data doesn't refer to Uganda in a crisis. It refers to normal time. But still, already established data sets can give you the contextual data. For instance, if for instance, if we know, if from your data collection on how many people are, how many people, if you collected new data that shows that 25%, like from a small sum, 1,000 people responded to your question on a local radio station in Arua, telling you, and say half of them are saying you've switched from one meal, from 2 meals to 1 meal. What census data could help you do is like extrapolate that, how many people actually live in Arua, right? So you'd be able to say, beyond, if this is true in general of Arua, this many people are at risk of hunger. So I mean, all data, national data, is always useful as a reference resource, but I think because this situation is so unique, and because we try to report new things, we try to inform people about the situation as it is, I think you're going to have to invest in some that you collect yourselves, but a lot of service providers, a lot of NGOs that were working on these issues are going to be data sources. Like, for instance, if you're looking at how many women are not coming for antenatal care, or how many women are now out of contraceptives, a service provider who was already providing contraceptives in rural areas or even urban areas, they can give you new data that, typically in a typical month, we do this many services. In this month, we've done this many. And then if you would like to, then you can look at sort of the old data, reference data sets, to paint a broader picture beyond, to paint a broader national picture. But also that being said, there's also some things like national surveys, national household surveys, or the demographic and health survey that remain useful and accurate, for a long time. And so what they say, for instance, about Ugandan society is still true in these instances. I mean, what percentage of Ugandans were poor in 2016 is probably more or less, the same percentage. So they are, so in and of themselves, they too can be useful. But how to answer what you're going to, like, I cannot start standing outside of a newsroom, say what you're going to do, how it's going to be useful to your own stories. But I think editors and journalists will do well to get into the habit of using these national survey books and and the census as a reference. Every time you're going to do a story, first read, what data exists in these things that might tell me something about the question I'm going out with.
If I could ask a final question, from a completely professional perspective, do you feel the media has done their job enough in this pandemic, in the covering of this pandemic?
I mean, I do feel informed as an audience member. I could. There's always room for improvement, but at the same time, as also a journalist who's watching a fast evolving situation, I do feel like, the media is trying, and very often try our best is what we can do, try our best. And then the fact that this is like a completely new pandemic, there's so much that's not known, which then means there's like so much you're not going to be able to tell the public whether you want to or not. And so, yeah, I feel the media is doing their best, and I do feel informed. I still have some questions. They're probably not questions for the media to answer, but questions I would have loved for the media to take to the authorities. I would like to see much more analysis of the impact this is having, the measures are having. I would like to see much more contextual information. Going back to your question of what can you do with all the data. So a new pandemic can feel like the biggest threat in the world, and no other threats are not. I'd like to see more data that puts the threat in context. Say, if the models are telling us, if we don't do anything, so many, say 100,000, 200,000 people will fall sick. I want to understand the number in the context of other causes of disease. Is that abnormal, or does that compare, for instance, to the number of people who die in Uganda, from regular pneumonia? And so I want to know, so there could be much more zooming out in the coverage, much more introduction or perspective. I think the national authorities they're rightly focusing on this thing in a monomaniacal manner, but that the media doesn't have to follow them in doing the same. You can introduce perspective, you can zoom out. Is this the biggest threat we've ever faced? Is this the biggest threat? For instance, right now, 1.4 million Ugandans live with HIV/AIDS. Should we be as panicky about a new pandemic to the total exclusion of service, healthcare to 1.4 million people? If you are in a country where 1.4 million, where there's an ongoing pandemic affecting 1.4 million people, should you be throwing all of your resources at a new one that is affecting 59 people, 55, is it 55 right now? Maybe not, but I think all of those conversations, should be on the table.
All right, thank you so much.
Now, the outbreak of COVID-19 came with it national lockdowns. With the lockdowns came a relentless urge to consume information. Many people have turned to the use of social media, but even on social media, traditional media has ruled the roost in access to vital information regarding COVID-19. This week, we spoke to The Timeline, a show that profiles what's happening on social media to find out how they were getting news and critical information to their audiences. We speak to Miracle Mbithi. Increased use of social media in the lockdown and in the midst of a global pandemic has brought with it new challenges, and we seek to understand how that has changed the show.
Just briefly tell us, since the start of COVID-19, how have you been able to get content for the show?
First, I must say it has been very difficult because of misinformation. That has been one of the biggest challenges on our part during this pandemic. Even the most credible sources that we knew about have also fallen victim to misinformation, because this is a disease that hasn't been there before. And so, we're just depending on research that is just being made during the pandemic. And so it's been tough, and it's been hard on our part. At a point, I've had to, stop getting, transferring information, giving out information basically, because you do not know what is factual and what isn't. And so we're only relying on what's coming from, say, the World Health Organization or the Ministry of Health. And so aside from that, we're trying to just keep away from it so that we do not raise a lot of panic, because it's been hard to prove what is factual and what isn't. Yeah, basically. But, you know, we've also focused on spreading hope, more spreading hope during this time, because we do not want to raise more panic. And, you know, there's already much going on around regarding the information that is being spread. So we're trying to spread more of hope and, you know, trying to focus on what good is coming out of this, such as the innovations, you know, people who are coming up with new things, people who have been able to sit down and develop things that can help make this easier on us in general. And so that is what we've been doing as the timeline. We have focused on challenges as well, you know, making it, showing people what's going on, what people are doing with their lockdown time, because this is a new way of life for majority of us. So just trying to ease the the tension, I would say, yeah, through just spreading hope, spreading smiles, and just, you know, how can we get away from the facts, you know, and the scariness of it, to how can we make this a little easier for people to walk through. Yeah,
we've seen, for example, a lot of content coming from people's homes, a lot of content coming from people
yes,
quarantine, a lot of it happening on different platforms. How have you guys dealt with this kind of content? This is probably the biggest time of content in the world ever.
yes, yes. First of all, we are doing our best not to spread, should I call it, opinions, with focusing on facts. So where it's just very opinionated and stuff, we try to keep away from that. And so we're focusing on, you know, should I call it the light stuff, what people are doing in their homes, what they're creating, what they're doing as families, and what they are, you know, cooking and you know, stuff like that. Just keeping away from spreading more panic and more tension, and keeping to spreading more hope. And yeah, so we basically, we do not take in everything. Yeah, we do not take in everyone's say and everyone's opinion. So we're basically focusing on the light stuff. We've seen all the challenges that are going around, the don't rush, the wardrobe challenges, and the different things. So we're focusing more on that, so that while the mainstream media is giving everyone the facts and all that, we are giving, you know, the light stuff, the one thing you'd want to turn on your socials and find and laugh about and feel better about. Yeah.
What would you say, what will be the future of social media post-COVID, or even during the COVID time? How do you see it changing? How have the platforms changed? I noticed a lot of people have moved from Twitter now onto TikTok. A lot of people have moved from Instagram videos to TikTok videos. How is that changing the way social media works?
How is that changing the way social media works? Now, we do see that more people are turning to social media for information. Yes. And so now it's good. The onus is on us to now be very sure about what we are spreading, because more and more people are waking up to find information on social media. So now we have to be more serious about what we are allowing to pass on, whether it's facts or not. And secondly, we do see that from now on, social media is well, as I think about that transfer, you know, from Twitter to TikTok and all that, we do see that social media is going to be more than just an entertainment, you know, platform. It's no longer just about, you know, pictures and all that. It's about how can we impact, how can we spread vital information, but in a less serious manner. I don't know if I kind of make sense in that way. In a less serious way, how can we make someone who does not like to, you know, turn on mainstream media have the vital information that they need, yet still not feel the need to disconnect from everything completely. Yeah. So I've seen that the TikTok videos, have also tried to spread more information about washing hands in a fun way, you know, through dance, through songs, through, you know, games and all that. So in the future, if something like this happened again, we know how to spread information in a lighter way, you know, for everybody to have the, you know, the vital information, but at the same time in a light way. And we, in the end, I would say we're protecting people's mental health. Yeah, so we are able to pass on all the information that's needed, but in a way that will also, you know, attract people, I would say, because I've spoken to a lot of people who are keeping away from socials, from mainstream. They just want to be locked up because there's just so much spreading that's causing them to feel like, okay, wow, I need to disconnect. So I think now we are seeing new ways of spreading information, so that people do not feel the need to disconnect. This is vital information, so they will feel the need to take it in, but also how they respond to it makes it lighter and makes the whole situation to be handled in a lighter way. Yeah.
And finally, if I could ask now, after post-COVID or even during COVID, a lot of mainstream media now has had to rely on online media to get its regular news sources of content. News houses are relying on the Twitter accounts of the Ministry of Health. Do you think that this is the time that social media is going to execute a coup d'etat over traditional media?
I think it is. I think this has shown that it has started. The coup d'etat has started because I have spoken to a lot of people who say they go to mainstream media when they have seen the story first on social media. So this is really showing us that social media has shifted. It has really shifted. It's now a major source of information, not just for us, but even for, you know, the mainstream media. And so it's important that we are careful what is put out. We are careful to ensure that factual information is brought out, because many people are relying on it. We need to be very careful to basically help everyone get what is correct, because yeah, basically social media is now the new thing. It's now the new major source of information. Even for me as a person, I'm always getting information from Twitter before I go to television. So yes, this, I would say, has shifted the way media, I'd say it has changed the trajectory of media.
December, before the COVID-19 outbreak got to Uganda, Dr. Olive Kobusinje authored a book, The Patient, which dealt very specifically with the problems that were happening in the healthcare system of the country. The book has come as such a timely reminder of how those problems would come to the forefront of fighting COVID-19. But the book also offers journalism and insider experience into what it looks like inside of the Ugandan healthcare system. This week, we also talked to Dr. Olive Kobusinje on her experiences writing the book and what she advises journalists to do in covering of COVID-19.
Story of the patient. It's a story of Ugandan doctors and their patients through the decades. It is a story of mostly young, enthusiastic becoming doctors and choosing a corrupt and impoverished world where their needs, their well-being, and their sanity compete with the needs of their patients. That it's a story of a hospital badly in need of healing and a healthcare system that fail. And that description would suit those years that we are going through right now, because up until that time there had been what would have seemed like systematic destruction of institutions, being including the health institutions, that healthcare workers were being trained under very circumstances. Very often in institutions that did not have the kind of equipment they should have. And although there was a lot of determination by both the students and the people that taught them, and indeed, you know, the book talks about both sacrifice and genius, it resulted in a service where people did not have appropriate training they were working in infrastructure that was dilapidated, that was really not where it should have been. And so that explains some of the results they were getting.
So tell us, when a virus as serious as Ebola arrives in Uganda, particularly in a place like Bulu, at a referral hospital, what does that do to the medical teams there?
So in the case of Ebola, it did not, so there were two epidemics. Well, there have been three huge epidemics, but there was first that was really big, 2000, ended in one, and then there was another one in 2007, there was a small one in 2011. We're talking about the ones in the year 2000 and probably the one in 2007. So the strains were the Ebola Sudan, which were related to previous epidemics that had happened in Sudan, but they actually seem to have originated in Gulu. So it was like somebody had come from somewhere else and had flown into the country and headed for Gulu. And so what it meant for the healthcare system at the time was that there was this very unusual illness that had come, that was acute, that was patients were getting very deteriorating rapidly, dying, and actually the healthcare, both the community and the healthcare workers were quite alert. So within a period of a few, they had alerted is an unusual illness that is killing people, and so that's how the response then started, with the late Dr. Matthew Lukuya, who was in Kampala, rushing back to Gulu and really starting off the organization for the response. There was a lot of input from the Ministry of Health and local institutions, but also WHO, CDC. So there was a strong concerted response to control that epidemic.
Many people have said COVID-19 pretty much looks like Ebola for Uganda in terms of the way it affected the country and the effect it has on the healthcare system. Is this a fair comparison at all?
Well, so there are certain things, they certainly have some things in common. The most obvious is they're both viruses. And the description that I have in the book, that epidemic in 2000, which would be very characteristic, each of them are highly contagious. They result in acute febrile illnesses that is potentially fatal, and there's no cure. So the similarities are there. However, there's striking differences. And I think the key differences are the way that they're transmitted. So Ebola requires contact, physical contact, for there to be transmission. And because it results in an acute febrile illness, the person that is transmitting, so actually Ebola, people that are going to suffer an Ebola illness do not transmit it until they are symptomatic. And once they are symptomatic, quite often beginning with an acute fever, then they are very ill. So they're not wandering around, going to visit their relatives, they are not catching a plane to go to another country. Once they have that, they become symptomatic, they develop the fever, they are ill, critically ill, and then they start shedding the virus. And very often they'll have diarrhea, they'll have vomiting, they'll be hemorrhagic fever, they'll be bleeding from all openings really, the mouth going up, from the nose, the eyes. So because of that, so these are with the virus, and because they require contact person or the bodies that are coming out, it's only those people that are close enough that are making contact with the person, with the fluids, and even the body is still teeming with viruses. So that's why barrier is a really big deal. So that is a striking difference between Ebola and coronavirus, because in COVID-19, people that carry the virus might never develop any symptoms. They can be in perfect health. They can be catching planes and traveling the world and be, going to weddings and going to the mall. And that gives them a huge opportunity to transmit the virus. Whereas the Ebola person becomes sick and is starting and they are getting the virus, they're very ill and they will die. Probably, if they're going to die, they will die for a week. So the virus actually doesn't give them too much time to spread to other people. The other big difference is that majority of catch. So in the big epic that we're talking about, 2007, mortality rate was about 3 minutes. People caught the disease, more than 50%, and actually in other epidemics it can go up at 90%. So it burns itself out because it kills a lot of the catch it, so they don't have the opportunity to pass it on to other people. And so if it's managed, it can be contained, and yes, there will be huge losses of lives, but they will be in a fairly short period of time, be contained, to, in a sense, burn itself out. So yeah, the differences between two viruses. And I think the idea that in Ebola there has to be physical contact, whereas we know in coronavirus, as we've been told countless times, is that you make physical contact with a person because the transmission is different. It's in aerosols. It's primarily respiratory disease. So it means that you can be at a distance and still catch it. And so fairly casual or being in the presence of somebody that is sneezing, is coughing, unless you have that distance, then you're likely to catch it.
You've been a very strong advocate for doctors, and particularly giving them the right equipment, equipping them right, paying them the right amount of money to keep them in the hospitals. And COVID-19 is sort of that shaker which has woken Uganda up to the fact that we have a health system that has been ailing for some time. Right. Have you made your own observations about this COVID-19 and how it's dealt with the healthcare system?
Yeah, so instances both in the Ebola and in COVID-19, you have health workers that are confronting a virus that is, a disease that is highly contagious and that is also potentially fatal, that, the consequences of the virus are dire. And unfortunately, in cases like, the one of Dr. Matthew Lukwia, Dr. Kule also, who died of Ebola, these were health workers that really paid the price. We also lost lots of nurses that a lot of people don't know about, but actually perished as they were looking after Ebola patients. So it's not new that nurses, doctors, radiographers, and other people that interactions will get ill because of contact with patients, and that's unfortunately some of them will die. So having that knowledge, it becomes really important that we then do not take it casually. We have seen what has happened in other countries that, doctors, nurses have died of COVID-19. And those were countries where they had more resources, and one would have thought that was here. So I guess I come to this with the sense that we really need to, let's not get this wrong. We don't have an endless supply of people, of health workers. Every health worker is somebody's, and it's a huge resource that we've developed. So we really and do a good job at that. And that the options are also known. So whereas there's been about what kind of protection, what kind of masks or respirators, so forth, and we are learning. I mean, it's a new virus, so every day we know a little bit better how it's going to behave. But at every stage, we need to use the best information that we have to protect our health workers the best way we can. And I think that not putting in the resources would be really unfortunate when it's something that we can do.
It's not just comparisons of COVID-19 to Ebola that have sprung anew for journalism in Uganda. This week on Memory Lane, we talked to one of the editors who was at the forefront of the reporting for the Ebola outbreak in 2000s, and he tells us how the media handled the outbreak then. It was evidently new to the media, but also evidently new to the country that a disease such as Ebola would take close to 200 people in its wake. Simon Kahiru speaks to us on how they covered Ebola.
The hospital is now better prepared to handle viral hemorrhagic fever.
The most enduring image of the calamitous 2000s outbreak of the viral Ebola fever was Dr. Matthew Lukuya. Then 43, Lukuya superintended over the medical response to a virus that would claim 224 Ugandans, him inclusive. Uganda's media relied on a backbone of correspondents who had been built during the LRA war to tell this developing but rather complex story. Simon Kahiru was an editor then at the New Vision.
In the early 2000s, as deputy editor of Sunday Vision from around about 2000 to 2003, for three and a half years, running the desk with Joachim Buwembo and what we call the Dream Team because of all the concepts we came up with and running the best-selling newspaper in the land. Actually, no newspaper has overtaken the sales that we used to do way back then.
So in 2000, Uganda recorded its first, what you'd call a viral disease. 2000, 2001, the Ebola virus broke out, starting from northern Uganda, spread down to Masindi. Just give us a sense, in the newsroom at that time, what was happening?
Well, first of all, it wasn't really the first because Uganda had an outbreak before of Ebola, though it was called something else. I think it was called Sudan Ebola or something in the 70s. But this was the first that was majorly recognized all around the world as a major outbreak of a disease few people could understand or even whose effects people could comprehend. And remember, this was after the LRA war had been running for quite a while, so when it broke out in Gulu, it took us a bit of time to get the story, not that long, but a couple of weeks, and then the story started coming out in bits and pieces as this mysterious disease that had suddenly broken out that people couldn't explain, and it was killing very many people. The first major point of alarm was there was no treatment for the disease, and I remember there was an alarming rate of death for the people who contracted the disease. And remember, because the LRA war was such a tight, it created a tight situation in Uganda, there was a limit to how much could come out of northern Uganda at that point. It was easing, but there was still a limit. But we had built up a good network, ironically, because of the war. So we had a good number of reporters in northern Uganda, and the government was communicating very, very well. And I think one of the great things about that time, or about covering that disease, was we'd had the experience of HIV/AIDS. So Uganda, has never been afraid to inform people about what's going on. So we didn't have any suspicions as to the information that we kept receiving. I remember it was Professor Maswa, who was DG of Health Services at the time, giving us updates on it became daily basis. And he was, and still is, a man of stature, a person you could rely on and believe in. So whatever we got from the Ministry of Health, we took and used, but also we had a very good set of reporters on ground that kept us well informed as to what was going on. And in addition, for New Vision in particular, we had a scientist on the team, and that made a very big difference. There was a gentleman called Dr. Wendo, Charles Wendo, who eventually became deputy editor, and then editor took my position after that. And he was a medical doctor. So he was very useful in explaining, deciphering some of the terms. Yes, so Dr. Wendo was very useful in the team because of his scientific background. So He could break down concepts for us and for our readers, explain what different things meant. He could question, interrogate even the scientists themselves in a language that they could understand, and then translate that into what ordinary people would, like me, for instance, would read and follow. And that was very, very good. And it gave us a great package to give the whole of Uganda, but more importantly to the rest of the world. Because again, remember, we're talking about the early 2000s when international reporting was considered to be more credible, more believable, more professional. But we actually took up our position. That was very good because we changed that Eurocentric or Western-centric approach to the reporting on Ebola. So we didn't allow it to be a Ugandan disease or an African disease. We actually reported it for what it was, which was a disease that could be contracted by anybody and could take anybody down if they did the wrong things. And that was very, very important.
In the earlier days, when the breakout happened, as editors dealing with reporters who probably hadn't encountered science reporting for the first time, did the newsroom have to have a meeting to teach reporters on how to report on this? Did you have to bring in scientists for people to understand how to report on it? Or you simply you learned with the ropes?
New Vision was, and still, a very different type of newspaper. Being at that time fully government owned, we always knew we had a certain responsibility to report news in a specific way. So on top of bringing in as many professionally trained journalists as possible, there were lots of courses that we went on, short courses in different fields. I mean, for instance, many men went to do gender reporting, gender-based, gender-sensitive reporting, so that they could also write for Women's Vision. And remember, New Vision had by that time created pullouts to cover specific fields, and you had Women's Vision, you had youth-based pullouts, we had SME pullouts, you had Business Vision. So all those sections required certain proficiencies, but we didn't have the luxury of assigning people to only specific fields. So what would happen is, for instance, a person like Simon Kaeru, when he was a freelance reporter, needed to pick up on as many of these different fields as possible in order to rack up his story count and earn more money. But I'd only do that if I actually reported properly on all those different topics or stories. So you had, at that time, journalists who were already well invested in science, in health, and who had the right editors to lead them to lead them into delivering the right stories. And besides Dr. Wendo, we had a couple of other science-based people in the newsroom who left their original professions and had come into newsroom practice. And also, which was very, very useful, we had a very, very good library system. So doing the research into the different other diseases of that nature, epidemics, being able to use the internet. I mean, early 2000s, but still, the internet was already available to a certain extent. And we relied a lot on all the resources that we could to make sure that our reports went out correct, accurate, and very importantly, non-alarmist. Because you'll note that over the years, every time we had an outbreak of whether it's Ebola, Marburg, or Congo hemorrhagic, we've always had this backlash from people saying, don't spoil the name of Uganda, don't mar tourism. But as a newspaper, what the New Vision has done very well is always push back and say, we have a duty to inform people and report. If just as much as we have a duty to support, the economy of Uganda when it comes to tourism and all that, we still have to tell people what they need to be told. And that balance was in most cases, has been well achieved. There have also been many challenges, Raymond, and even today, right now, you could say that the entire world is lucky that Corona has covered the entire world. But if it had been specific to one place, as it was in the beginning with Wuhan, you'd have found a reluctance to say a lot about the disease in that one place. But now, because it's spread so widely, everybody's willing to share experiences, to provide information, because they know, you need as much help as you can get. And at that time, we didn't have this as a luxury.
Tell me about the public perception of the newspaper during that period of time. You have a headline reading, "Viruses in the country." What did the public perceive of the paper at that time?
Well, it was a government newspaper, but also remember that we only had 2 mainstream dailies, English dailies, for the longest time. New Vision, Monitor, Daily Monitor. And at that time, it was quite simple in everybody's mind. Government paper, opposition paper, opposition quotation marks. But when it came to the Ebola story, it was quite clear. If somebody is dying, they're dying. If it was symptoms of Ebola, those are the symptoms of Ebola. We didn't really have that a rivalry between the newspapers, as far as I can remember, in covering this particular news item. And I even there's a memory I have of New Vision and Monitor. I can't really place my finger on which story it was, but New Vision and Monitor coinciding with a story on Ebola. It could have been related to Dr. Okuya, maybe, but coinciding with a story and people asking, wow, how did you guys get this? But that's because, like I said, you had this one enclave of Uganda that was really locked away from the rest. You had the Ministry of Health being your main source of information, but then everybody understood that if we don't get together and deal with this disease, it's going to cause a much bigger problem. And by the way, one thing I must point out, Raymond, is because the disease broke out in northern Uganda, there was at some point a discomfort with the way it was being covered as, it's way over there. So we also had to create this understanding in people that whereas it has broken out in one part of Uganda, if it shows up in another part of Uganda, believe me, all of us will be affected the same. And I think that's set a good basis for what we're going through now as a country and even as a globe.
The other question I wanted to ask you is, journalism has to inform, but we also have to hold to account. And you raise a good story with Dr. Matthew Lukuya. One of the things that has been written in books thereafter, including even Omaswa, is that there could have been better protections for health workers who are dealing with Ebola at that time. It's only that Uganda didn't have the capacity, didn't even have the knowledge to protect the doctors at that time. Was there a sense from the editors that there should have been accountability on the part of government saying, this is what you need to give health workers? And did you report on that?
To be quite frank, no. The same way the health workers themselves did not know. There was no way anybody else could know what needed to be done. Everybody was investigating this as it was happening. Actually, Dr. Lukuya, may his soul rest in peace, he was declared a hero because he went in and gave his all, even after realizing what the risks were, you see. But he realized those risks because he was right at the front line itself. He could see what the dangers were, but he still did what he needed to. And by the time he was tested, and his results were taken to South Africa, he knew that it was a tight situation and he stopped, you see. Now at that time, you were not going to talk about government of Uganda, you need to do this, when we didn't even have a lab for testing in country. No one could have thought at that time that we needed as a country to have a lab equipped to that level. Remember, this is only how many years after we come out of, a couple of decades of war and economic destruction. So it was not a thing of, like you see today, where we are asking Parliament to be more responsible about their approach to COVID. That time was very different. Today we have a much better opportunity, and it's one of the silver linings of this COVID-19 crisis. We have a very good opportunity to strengthen our ability to hold government to account, to hold our leaders to account, to hold not only our government leaders, but even our business leaders, to hold them to account. Because we know a lot more. We know that there could have been much better preparation for certain things. And we know that even if there had not been that preparation, where we are today, we need to be preparing for more that's going to come after this that we can see happening. With Ebola, I mean, like I said, it happened in one part of the country. It actually was even worse in Congo, for instance. But you didn't have a newspaper in the Congo covering what was happening there. To this day, nobody's going to tell you exactly how many people died in the Congo. But here, at least, we had that robust system that controlled, managed, treated, and then built capacity. So that's why right now we applaud the health workers, we applaud government for what has been done. but we still push them to the wall more today than we could back then.
Simon, my final question to you. There's many young reporters who are going to watch this program, and the question for them is, COVID-19 is actually happening in their lifetime. How should they report? What should they get right? Where should they put their energies?
Okay, and believe me, I have a lot to say around that, but I think what our journalists in this country need to do, and even around the world, is harness the opportunity you've got now to get the story right and to chase the story all the way down the wire. Right now, a lot of what we see is journalists picking up a tweet and turning that into news. I mean, I actually see media houses saying, breaking news, 21 days extension. That's not breaking news. The entire country has watched it. You're not telling them anything. But you need to be going behind that breaking news to find the actual breaking news. We need to be holding government to account. Like I said, business leaders to account. I'm now involved in corporate business, and I'm seeing lots of donations. I've had a very entertaining couple of weeks over donations. But what do those donations mean? Where are they going? You know, what's happening inside the company that's donating those amounts? Has that company been paying taxes? There are so many things that we need to understand now, and even more importantly, what's going to happen after the lockdown? What's going to happen? Is there an after COVID? What does it look like? What should people think? What should they prepare for? There's a lot that
Thank you and welcome back. Now, this week was the week in which the lockdown was extended for an extra 21 days. And on social media, people were not taking the news with a happy strand. However, some happy users of social media put an edit of music to the presidential address and made it all the more merrier. This week, we leave you with what's happening on social media with the 21 days video. I've been Raymond Mujini. Join us again next Sunday as we do this, the NTV Fourth Estate.